Augmentation can mean different things to different people. So a lot of people, this is just that have innately small breast want larger breast. But for a lot of people, it's restoring what they used to have. So you think about that after pregnancy or weight loss, putting volume back, and sometimes that's the upper portion of the breast, but it can be all of the breast as well. Most commonly that's done with an implant, but we can do that with fat as well. I think there's been somewhat of a trend over the last, decade maybe, since we really started doing more fat grafting, to lean towards fat grafting in people that are the right candidates. So those are people that already have some breast volume and that want just to improve it by a percentage, and as opposed to doubling that breast volume or tripling that breast volume. Implants have come a long way over the last few decades. The breast implants themselves are very safe. They should last a long time. Implant makers, of course, say expect them to last 10 years. What does that mean? It means they show the FDA safety information over 10 years. But in reality, most people will have intact implants for 25 or 30 years. I think the most common type of incisions are under the breast or around the areola. In some cases, we can go through the armpit. That was easier when we did saline implants when they were around, because you blew them up once they were in the pocket. But the implants themselves too, we have different sizes, different shapes, different types of implants as well. And that in itself is a conversation with each individual patient. I always sort of point out that an implant's kind of like a shoe size, that someone who's 5'2" doesn't wear the same size shoe as their friends that are 5'10", and they're not going to wear the same size implants either.